If I go on Zoom, the people will hear me, the public? Sorry, that's okay.
Good afternoon, everyone, and thank you for joining for this update and media briefing. I am Lisa Lord. We will be addressed this afternoon by the Health Minister, Lieutenant Colonel the Honourable Jeffrey Bostic, as well as the Minister of Education, Technological and Vocational Training, the Honourable Santia Bradshaw. We're also joined by the Acting Chief Education Officer, Ms. Joy Adamson. We will begin with an update first from Minister Bostic.
Thank you very much, Lisa. Good evening, everyone. First of all, I think I need to say Happy Mother's Day to all mothers across our fair land, and also to our nurses. First of all, to say thank you for your dedication and hard work over the past year. And as you start your celebrations for Nurses Week today, I just wish that you would have a very, very successful and enjoyable week, and I hope to be able to join you at some point in time during the week. We would have done about 757 samples yesterday, and we have 504 results that are back. There's some other results that are being processed, and I know that some have been sent out, but I don't have the update at this point. But these 504 really comprise some tests that we were eagerly anticipating because of the impact on one or two things that I would have indicated to you during the last press conference. So of those 504 today, we have 9 new positives, 6 female and 3 males. 8 are Barbadians, 1 non-Barbadian. In addition to that, 3 persons will be going to Harrison Point for assessment. Now, out of these 9 positive cases today, we have 7 cases that are attributed to 2 family clusters that we've been following for the past several days. One of those family clusters had 3 and the other 4. So that the one that had 3 positives today, they now have 17 persons positive in that family, and the other there are 2 households with 8 positives. Of interest is the 2 households with 8 positives, because that is the family cluster that has impacted on 2 of our schools, 1 primary and 1 secondary. And I will give some information in relation to where we are with those 2. I would have indicated that there was a primary contact and close contact of a positive case at the St. George Primary School. That contact would have had a negative test, first test, 5 to 6 days ago, and was awaiting the exit or screening test, which the result came back today, and that student is now negative, again, negative, and therefore cleared. And as a result of that, there is no requirement from a public health perspective to do any contact tracing within that particular school, because this particular student would have been in quarantine in a government quarantine hotel for the past 5 or 6 days, and when they were seroconverted, would have been at the hotel in quarantine and not at school, not in contact with any of the students at the St. George Primary School. So from a public health perspective, that school is cleared. Let me say, however, that we will continue to offer any testing that persons attending the school or any other school or institution in this country, if people want to have a random test, we are prepared to do so, and that has been offered to this school as we continue to try to do as much testing as we possibly can. The other student, which is from the Princess Margaret Secondary School, that was the positive case. The members of staff and students of the classes that we were targeting, they have all had negative tests today from their exit or screening tests, and they are also free and cleared to return to school. We will continue to provide any assistance to that school as well as needed, and if there are any persons for whatever reason who are desirous of having a test, we will facilitate that request. But at this point in time, and as I had indicated at the last press conference, thankfully we do not have an outbreak in any of our schools, and these 2 situations with the schools from a public health perspective, they have now been closed. But we will continue, as I said, to provide any assistance as required. So those are the majority of the positive cases that we would have had today. And I am really happy that the outcome is as it is, because obviously this was a cause for concern. And we are very happy that the public health measures, the protocols that would have been used and followed within the schools have actually worked, and we are hoping that this will continue throughout the whole educational system and in the country in general. Lisa, that is my brief for now. Thank you.
Thank you very much, Minister Bostic. We now go to Minister Bradshaw.
Thank you so much, Lisa. Pleasant good afternoon to all Barbadians, and just let me join with my colleague minister in wishing all mothers and those who mother a happy Mother's Day, particularly, as he said, those mothers who are on the front line, but also our teachers across the educational system, our principals who are also mothers as well, because during this particularly difficult period, they have had to juggle teaching and also managing their homes with their own children as well. I know that while the celebrations this year are a bit low-keyed, it does not in any way diminish the importance and the value to which we hold our mothers to in this country. At the outset as well, let me extend sincere thanks to Minister Bostic and his entire team in the Ministry of Health and Wellness for yet again acting swiftly to assist the Ministry of Education and our stakeholders to respond to the finding of the positive case of a student last week. Our first experience when we went through this exercise back in, I believe it was term 1, was a very frightening one, I think, for all of us. And we didn't know as much as we know now as we did then. But it was an experience that demonstrated that with proactive leadership and decisive action being taken by the Ministry of Health and Wellness, that we were able to confront the challenges and return our children safely to the school environment to continue their studies. The truth is that every discovery of cases of COVID-19 affecting children is going to be a frightening one for most Barbadians, especially those of you who have children in the respective schools, and also for our teachers who may not know quite what to expect as a result of the positive case. But we also know that we cannot exist living in fear either. And it is for that reason that from early on in this pandemic, we took a decision that we wanted to make sure that we introduce safety monitors into the schools to be able to assist the teachers and the principals and the ancillary staff, certainly in the learning environment, to be able to have that additional support that was necessary to make sure that the students kept on their masks, that they were physically distanced, and that they were participating in sanitizing at all points during the school day. The reality is that each of us, parents, guardians, principals, teachers, ancillary staff, safety monitors, the health and safety committees across the schools and the general public, all have a responsibility to ensure that the health and safety protocols are being followed in order to keep our communities, our workplaces, and our students and our schools safe. Acting on the advice, therefore, of the Ministry of Health and Wellness, we are satisfied in the Ministry of Education that the phased return to the classroom can commence from this Tuesday, the 11th of May. On Friday last week, the Chief Education Officer acting, Mrs. Joy Adamson, would have convened a brief meeting with the principals of all primary, nursery, special needs institutions, and secondary schools in order to discuss future plans for the phased approach for return to the classroom environment. The truth is that we had always said that after the first week we would start to evaluate. We wanted to give these schools an opportunity to settle down, to allow teachers and principals to be able to fine-tune any issues that may have presented themselves. And last week was as eventful a week as any in education. We had issues at a number of the schools, not certainly as many as we perhaps may have expected, but the issue of the ashfall was very much still a challenge for some institutions, and we've been able to get those things wrestled to the ground and be able to move on in terms of teaching and learning in the environment. At present, we have approximately 26 small primary schools, which as of today can take in all of their students on Tuesday the 11th. We also have 4 of our large schools, that would be George Lamin, Arthur Smith, Hilda Skene, and St. Stephen's Primary, which are also in a position to take in all of their students using a phased approach. And the reason for this is that we want to give the teachers and the students enough time to settle each of the year groups before bringing in another year group. I must say that there have been some very ambitious principals and certainly great leaders across these institutions who have tried their best to get these children back into the institution, because I feel all of us have recognized that many of the students are suffering at home, and that being in the face-to-face environment is obviously a preferable environment for most of these kids. At all other primary schools, we will use a blended approach for the students, which simply means some days will be online, some days will be face-to-face, and many of you would already be familiar with that system since it was already executed in term 1. Effective also from Tuesday, May the 11th, you will see now the class 2 and reception students returning, and on Thursday, May the 13th, this will be followed by the class 1, infants A and infants B at our primary schools. If there are any changes to this, our principals and our teachers will reach out to parents directly. And let me just say here that it is imperative on parents to ensure that they update the information, the contact information available to our schools, because especially in this environment, I know that people are moving around, but the truth is that we need to make sure that our schools can reach out to you as quickly as possible, but also in the event that we have to do any kind of contact tracing, it would assist the Ministry of Health and Wellness greatly if we have up-to-date contact information on the file. All class 3s and 4s, nursery schools and special needs schools will therefore continue face-to-face on Monday, and all other primary school students will remain online. With respect to secondary schools, 16 out of our 21 principals would have requested that no other classes be phased in face-to-face next week due to, for the most part, a lack of space on the school plant. And this is to allow the exam forms, the 5th and the 6th form students, to complete their module tests, their labs and practicals, that they pretty much are using a number of spaces at the school plant, and therefore it is desirable that they have the full reign of the school plant at this point in time. 2 of our secondary schools, Darrell Jordan and Grantley Adams, have a smaller number of students, writing examinations, and they can therefore accommodate students from this Tuesday as well. Our 2nd form and lower 5th forms at Darrell Jordan, and the 1st and the 2nd form students will also be returning to the plant from Tuesday. Principals will inform the other forms when they will be allowed to return to the school plant. With respect to Form 4 students who are writing the CXC mass examination at Queen's College, Christchurch Foundation School, and the Lodge School, those will be advised of their days to attend face-to-face this week by their principals. Let me just say that given the fluidity of the current situation, the fact that we have come to expect that COVID cases will be around for a while, whether in the communities, the workplaces, or even in our schools, we have determined that information regarding classes and the scheduling of timetables will be uploaded to the Ministry of Education's website and also to the Media Resource Department's social media pages over the coming weeks. That is not to say that you will not also receive information directly from your respective schools, but I believe it would ease a number of parents if we have all of the information in one location. And as promised, the School Alert app should be able to be rolled out later this week to allow our various schools to use that to communicate directly with our parents and certainly the general public on alerts and notices that may need to go directly to their phones as well. There have been many concerns regarding the school environment. I've heard much concern about whether the students are wearing masks, and for the most part, a lot of our students are wearing their masks and abiding by the various protocols. I would urge parents to use this exercise as a learning curve for many of you. If the students were not wearing the mask before, again, I implore you to require your students as they're going to school to have their masks available and also to adhere to the protocols in the schools. This has taught us that we have to pay attention and greater attention to the protocols, and therefore it is important that students adhere to the mask wearing, not just in this classroom, not just outside of the corridors, but they need to adhere to it on their way to school. They need to adhere to it on their way from school, at the bus stops. When they are walking, they need to obviously, especially if they're in groups of other children and they're talking, they need to adhere to wearing their masks. It is the only way to ensure that we can keep our communities, but also our students safe in the school environment. As it relates to concerns regarding the 3 feet versus the 6 feet spacing in the classroom, we have determined, based on all of the international guidelines, all of the advice from the Ministry of Health and Wellness, that the 3 feet rule will remain for the most part across our schools. It has allowed us to be able to have more students having the face-to-face, and so long as the protocols are followed, at this stage there is no reason for us to determine otherwise. And I believe the Ministry of Health and Wellness has an upcoming session with the various unions this week to be able to further answer any of their questions and certainly to bring them up to date as to what the international guidelines are in relation to the spacing of students in the classroom. But the key here is that so long as you are wearing the mask, you are following the basic protocols of hand sanitization, and certainly keeping your distance, the 3 feet distancing, schools are actually quite safe in relation to other spaces. And the key is that the protocols that are in the schools are actually even at a higher level than in some other places as well. So for the most part, we consider the school environment to be relatively safe. And I would just want that, parents who are anxious, teachers who are anxious, just appreciate the effort that we're trying to make to ensure that all of the spaces across the schools are properly marked, to make sure that we reinforce these positive behaviors in our students. But we require the cooperation of all Barbadians if we are to return these students and teachers safely to the classroom. I also want to support my colleague minister in relation to the whole issue of testing, because we believe that this is the only way that we're going to wrestle this issue to the ground. It really requires the Ministry of Health and Wellness being in a position to know exactly where our COVID cases are and to be able to take action quickly. And therefore, we want to encourage all teachers, if they believe that they've been exposed, or even if they just want the satisfaction of knowing their status, to be able to go to any of the polyclinics. And I believe Minister Bostic has indicated that, certainly preference will be given to them once they identify themselves as members of the teaching profession. As it relates to our students, many parents have certainly called and asked me whether they should get their children tested. And the answer is simple. If you believe that you've been exposed, if you believe your children have been exposed, then perhaps the best thing to do is, in fact, to go to get tested. Just being mindful that, of course, it's not a system at the polyclinics where it is priority being given to students. But the truth is, much depends on what is happening in the Ministry of Health and Wellness, or even in those polyclinics on the given day. But I do feel that the message that needs to hit home across Barbados is that testing is the only way for us to know our status. It is the only way for us to be able to be our brother's keeper, and therefore we need to do all that we can to protect ourselves, but also to protect others as well. So I am satisfied at this point that, having met with the Ministry of Health and Wellness and the officials, that the plans for the phased return to school can continue. We will continue to make sure that we adhere to the various protocols that exist, that we ensure that we are able to brief our students or teachers in relation to those protocols, and certainly the assistance of the COVID monitoring unit in particular is going to be felt even more over the course of the next couple of weeks. We have a team in place through the Ministry of Health and Wellness, which is dedicated to the school system. They will also be at the bus stops. They will also be working with the principals and the teachers to make sure that any concerns which they may have can obviously be addressed in short order. But I urge Barbadians not to panic. It's okay to be anxious, but right now we don't need to have this fear overwhelming us in such a way that we're not able to function as a society. And therefore all anxieties are being taken into account by the Ministry of Education. We've done everything, I think, that at this point that we can possibly do to ensure that the school environment is safe. But really, it is a whole of school approach that we're asking for. Everyone has to play their part. Thank you. Thank you, Lisa.
Minister Bradshaw. Turning now to members of the media. Joining us are Ian Bourne, the Bajan reporter, Barry Aline, the Nation newspaper, Kezia Innes, Starcom Network, Michael Phillips, the Barbados Advocate. I do believe we have Shamar Blunt from Barbados Today, and Aaliyah Briggs from CBC.
Good afternoon, everyone. This is Barry Aline from the Nation. Question for the Minister of Health, Mr. Bostic.
Proceed, Barry.
Well, good afternoon, Minister. With the news that so many students will be returning, full complements of students will be returning to plants across the country, the question is, has your ministry contemplated if you may need to also conduct random testing of students and staff going forward out of an abundance of caution?
Thank you, Barry. The answer is yes. Ideally, we would like to do random testing in several areas, not only within the educational system. I know that a few weeks ago, the permanent secretary in the ministry had put together a small team of persons that were responsible, those persons, for calling around at various institutions, even business places and so on, and offering that service to those institutions. And we do that. We will do that also for schools and for individuals, because that is the one way, especially if we're getting people coming from across the various communities in the country, that would give us a clear indication as to exactly what is happening. And so that is there, that office there, that is what I was speaking to earlier.
And the big second question, Minister, you didn't mention the psychiatric hospital cluster today. Is the ministry satisfied that that is not necessarily closed, but is it mitigated and in control and contained?
Yes, mitigated, and especially the internal aspect of it. We are still pursuing some of the contact tracing for those persons who would have been discharged within the last 2 or 3 weeks. We've done a lot of testing, but there's still 1 or 2 persons that we're seeking out. But we are feeling fairly good within ourselves that that situation is under control, but it is not yet a closed case. We are still going to be pursuing some other contacts.
And I believe you were next.
Yes, good afternoon. I have a question for Minister Bradshaw. I'm sure it's one that's playing in the minds of many parents and students. What is the case regarding the 11 plus based on the level of preparation you just explained?
Thank you, Ian. I feel like I've been explaining this for several weeks, and I keep getting the same question over and over. We would have said several weeks ago, when we first had the spike in cases, that we wanted to give our students the opportunity when they return to the classroom to be assessed, because we recognize that a number of students may have fallen behind, a number of teachers may not have completed certain aspects of the syllabi, and we don't want to place our students in a position where the only focus is on sitting an examination. We still want to know that they've been able to grasp certain concepts, that the students are comfortable, that they understand that we care about their mental health and wellness as well. So last week, because of all of the different teething issues, we decided to postpone the first set of assessments, and I believe those will take place later in the coming week, and then we should be in a position to report to the country as to the status of the 11 plus. But it really is an ongoing assessment of our students and trying to get a sense from them how they feel. I can tell you that some of the students, when I visited a number of the schools last week, indicated to me their own anxieties about sitting the 11 plus. And it wasn't just the typical anxieties. They did express, without any prompting from myself, from any of the teachers or anyone, that they felt that they were being rushed through to get the subject completed in the particular areas. And I don't know that I can ignore that as minister. I don't know that any of us can ignore the cries of our young people indicating that they feel that they are overwhelmed at this point in time. So I would ask that, again, that we give the students and the teachers the opportunity to settle, to allow the teachers to do the necessary assessments. Our student support team is also there to provide the additional support to students who may be having particular challenges in terms of emotionally relating to the examination as well. But I believe because we have the control over when the exam date will be, it really is one of those things where we have to just see where our students are at first, and then we can make an informed decision as to the way forward.
You had mentioned pre-COVID about finding ways other than the 11 plus. How does this current situation, and based on your level of preparation, does this help towards achieving that goal about essentially doing away with the 11 plus?
I think it's fair to say that once we've done the assessments, all of the options that are available to us will be explored. We've looked at, different modifications to the tests. We've looked at, yes, the abolition of the examination, because that has been on the table for quite some time. But we never got the opportunity to be able to do the consultations because of the pandemic. So in fairness, I think the first place we must start with this year is by looking at where our students are and then making a determination as to what is in the best interest for them. I think you would also also be aware that we have recently established the Education Reform Unit. That has kicked off last week. We've started our discussions internally regarding what the abolition of the 11 plus would look like, and obviously what the proposals would be on the table for the changes to be made. As to when those will take place, again, that is obviously for the Cabinet of Barbados to decide, but internally we have started those discussions and the consultations with the various stakeholders. So hopefully yourselves and certainly the media certainly and all other stakeholders will have the opportunity to weigh in on those discussions.
Michael, I believe you were next.
Hi, good evening. My question is for Minister Bostic. Minister Bradshaw. Minister Bostic would have made mention of a special situation where teachers or school staff could go get tested if they choose to. My question is there or will there be a priority situation for teachers to be vaccinated, teachers and staff to be vaccinated if they choose to?
I think you were a little behind. We have already given priority to our teachers. The last batch of vaccines, many of them have already been vaccinated, and that process is continuing. We've treated them in the same way that we would our frontline workers, recognizing that in order to get the students back into the classroom, it is important that we give them a certain level of protection and a certain level of comfort. There's always going to be the hesitation as to whether you get a vaccine or not, but for the most part, this government has allowed our teachers to certainly be given that level of priority in the system.
Are there any further questions?
Yes, thank you. Sorry, Kizia. Go ahead, Kizia.
Okay. This question is to both Minister Bostic and Ms. Bradshaw. How do you respond to Bishop Atherley's view in that we're not ready as yet to go back to school, as in it was a mistake to return to face-to-face classes?
I think Mr. Badley also had concerns about us returning in the virtual environment to conduct the business of Parliament. But the reality is the world cannot stop because of COVID. And just as we have a country to run, we also have students to educate. The key in all of this is that we've put the necessary precautions in place to make sure that people are safe. So I understand, and I think all of my colleagues do understand the fears that people have, and many of them are genuine. But we have basically taken a position that we have to manage this crisis. And crawling up under a rock and playing dead is not going to solve this problem. It's not going to allow COVID to go away. What we've chosen instead to do is to speak with the country, provide as much information as possible so that people can have a sense of what is really transpiring. All of the medical evidence is suggesting that once you put the necessary protocols in place, once those protocols are enforced, that it is rather safe to go back into the school environment. The risk in terms of our students is rather low, and therefore, while students are part of the wider community and they're in households where adults may contract the virus, the reality is that we can't stop them from contracting it, but we have to make sure, as we have done, that we provide the monitors at the entrance to the schools to test the temperature, that we have the protocols in place to make sure if they're feeling unwell that teachers know what to do. We have made sure that we provided the masks to ensure that the students are provided with them if their parents don't have access to them. And at each juncture, we are simply trying to allow some level of normalcy in a very abnormal environment to return. But what this government will not do is simply do nothing. And I think that really needs to be appreciated and understood. The rest of the world everybody's trying their best to cope. And I don't think Barbados's government is any different. So I hope that answers your question.
And Barry?
Yes, Bradshaw, thank you. Happy Mother's Day. I've heard you say before at press conferences that there's seldom unanimous acceptance of any decisions made, but I'm at pains to ask what level of acceptance there was by the school principals associations and the teachers unions with regard to this large scale return to class.
Well, the announcement I'm making today is really consistent with what we've said even prior to the return to school. We've consulted with all of the unions. Many of them have shared their concerns, but many of them are also sharing the same view that we have in the Ministry of Education, that we need to get these students back into a face-to-face learning and teaching environment. And they are willing still to support the initiatives of the Ministry of Education to allow that to happen. I think if you ask most children out there if they want to return to the school environment, the answer is a resounding yes. Now, what we have a responsibility to do is to recognize that all children will not learn in the same way. There are some who actually don't like being on in the face-to-face. Some of them, I remember some students told me that because they're into gaming, for instance, they like to be online. They prefer to have interaction with students online. The reality is that all of the statistics, all of the research shows that our children will learn better if they are face-to-face. And all of the science shows that protecting them and making sure that the protocols are in place is really what will lessen the risk of transmission. So I would have to say that there is maybe not always consensus, but I think there is an understanding amongst our stakeholders that we have to move in this direction, and we have to fine-tune and we have to tweak. It's not going to be perfect, but we have to fine-tune and we have to tweak until we get it right. And that's why we've said phased approach. And just to reiterate, I heard you say large-scale return to the classroom. I want you to remember that we are saying small schools where the spacing or the classrooms are not at full capacity are returning with all of the students coming in. The other schools, however, will have a phased approach. So I don't want the headline to say, or to misquote me, that we're having all students back at school come Tuesday. That is not the case. We have met with our principals, we've met with our stakeholders, and we've said some schools will require a different approach depending on the layout of the plant, depending on if we had to, in some schools, the chief education officer is here, she can speak to it as well. We've even sourced tents in order to be able to accommodate children on the outside. We've had to get creative because the one thing we cannot do is to do nothing, because there is going to be more harm to our students in the long term if we allow them to remain at home. And I think you would know as well, Barry, that many of these students rely on the school meal system. Many of them rely on that interaction with their teachers who do a tremendous job being their surrogate parents as well and giving them the necessary guidance. And therefore, it is our responsibility to make sure that the children are able to go back in safely, but also that our teachers are also feeling comfortable being able to teach these children in the classroom environment. And the truth is, many of the teachers also have children as well, and many of them have expressed that they would like to see the return of their own children to a classroom environment that is safe also. So I think we have to find the right balance. We're not going to please everyone, but as we've said from the beginning of this pandemic, we're going to be guided by the science. The Ministry of Education doesn't make the decisions itself. We come after thorough consultation, not only with the stakeholders, but we also speak very closely with the Ministry of Health and Wellness. So I give the public the assurance that while we may not always get consensus, certainly we do take on board all of the views and the concerns, and we try our best to be able to at least meet people halfway.
Thank you. Final question from me for Minister Bostic. Minister, could you give us an indication as to what level of numbers you would have seen with people volunteering to come get tested out of the 2 clusters involving the schools? I know you mentioned contact tracing, but you had also made a call last week for any interested persons who wanted to be tested to come forward. What was the response to that?
I think that we've seen a number of persons. I cannot give you the exact figures because those figures are elsewhere. But we've seen a number of persons who have volunteered and who came forward to be tested, including, in some cases, persons who might not even have been at school at that particular point in time. They came forward to be tested. So this is the direction that we would like to continue going in, and it could only be for the benefit of the country if we have this happening. But yes, some people have come forward, but I can't tell you that it was an overwhelming success, but it was good enough for us to be able to get an idea as to what is happening out there.
Are there any further questions? If there are no further questions, as we close, let me thank the Minister of Health and Wellness, Lieutenant Colonel the Honourable Jeffrey Bostic, the Minister of Education, Technological and Vocational Training, the Honourable Santia Bradshaw, the Acting Chief Education Officer, Mrs. Joy Adamson, members of the media, thank you, and you at home for joining. Good evening.